Hey everyone, welcome back to Psych with Dr. DK. I am Dr. DK at your service. Today we're talking about self-diagnosing and the dangers of self-diagnosing. And I think the first thing that we typically do is when we start to feel a symptom, we either Google or we go to WebMD or we grab a book and we look up our symptoms to see what we have. And 9 times out of 10, when we do this, Google tells us that we're dying because we are checking the box on symptoms and not conditions of what is actually our diagnosis. So within America, there's so much going on. I kind of want to break that down and why it's so dangerous and what else it could lead to. So when we're self-diagnosing, basically what that means is that you are taking a symptom that you have and you're saying this symptom is this disorder or this illness, and you're running with a treatment to try to fix it. I want to caution you first to make sure you're not doing that. I know it is so easy just to go to Google and to basically like Google University to say, I know what my body feels and I know that this is not right. Now, the danger is, there's nothing wrong with that, but the danger that we fall in, the pitfall that we fall into is self-diagnosing and saying, well, I have a stomach problem. I have IBS, and you've never actually gone to the doctor to get it checked, to see where your blood levels are, or you say like, well, I have a history of my family having diabetes, so I must have diabetes. So you start to self-medicate, and sometimes people have given themselves insulin just because they're like, well, it runs in my family, I'm being proactive. That's not how medication works. It's actually very dangerous to do this. Now, this would be the same as looking at a friend and saying like, I have their symptoms and I must have that disorder too, or that illness. I often think of like how my brain works is that it's just interesting how our brains work. So when we are in a room and someone's like, there's a spider, and like you see the spider crawling on someone, it's just gross, and it like you killed a spider and you're good to go. But all day long, you feel like you have this spider on you. So what tends to happen is the rest of the day you're obsessing over this spider. Even though there's no spider, there's no harm. But mentally, we're still thinking on it. So when we're looking up our own diagnoses and we're looking up our symptoms, we start to overstress over it, or we start to ignore it. So I also think of just how when someone says that they have lice, everyone around them starts to like scratch their head and like, oh my gosh, like I have lice too. And I know all of you guys are probably scratching your scalp now because I said lice, but I think of how our mind works sometimes is that sometimes we really do have a diagnosis. We do have an illness that needs to be medicated. And then there's other times where we kind of take on somebody else's symptoms and like, we start to overthink that almost like hypochondriac status, where we start to think we have every illness out there. And it's really, really bad because we are so plugged into the Google that we do one of two things. We jump into every symptom possible and we start to panic because we are scared of our health issues, and we want to be proactive and we want to get the right medications, and we just kind of go and diagnose ourselves. And then we go to our doctor and we're like, hey, this is what I have. I can prove it. Here are all my symptoms. And we ignore the underlying health issue that could actually be there. Now, on the other side, when we're self-diagnosing, we could actually underdiagnose. So there's the overdiagnosing where we have everything. And then there's the underdiagnosis where we're just like, no, we don't have that. Yes, I have this. Yes, I almost pass out every single day if I don't eat by a certain time. And then we're not going to the doctor because we're like, we're fine. We don't need to do this. I just have anxiety, or I have low blood sugar. But you actually have something else going on, and you never know because you never actually do the tests to look at what's going on internally. So I was doing some research because that's just what I love to do. And one of the things I came across was Banner Health Blog. Now, in November of 2021, they actually did a blog to kind of say like, hey guys, chill out, because they noticed that TikTokers, young TikTokers, were starting to self-diagnose themselves with mental health issues based off videos that they saw on TikTok. They started to notice that a lot, like mental health psychiatrists were like, why is this happening? And someone's like, well, I saw on TikTok that if I have this, I have Tourette's. If I have this symptom, I have anxiety. If I have this symptom, I have depression. And the medication that they prescribed to this individual was 2 weeks off of TikTok, because they're like, let's actually see, like, do you have a history of this in your family? No. When did it start developing? Oh, I saw this video and I started, getting obsessed over it. And I actually have that. And they would develop these symptoms based off of this. Now, here's the danger. They literally went to their doctor and said, I have this disability, or I have this illness. And their doctor was trying to figure out what to do. Now, if you go to a general practitioner, you usually get referred to a psychiatrist to kind of walk through the mental side of things, the mental health side of things. So when they did this study, they prescribed 2 weeks off of TikTok and counseling to kind of walk through and talk through some of what's going on, figure out when it was developed. And they found that most, if not all, these individuals who had been coming in for these symptoms, the symptoms went away. And they found there was underlying anxiety, underlying depression, and underlying stress that was causing their bodies to overdo things. And then as they were watching these videos, they over-obsessed over it, and they took on these symptoms. Now, I try to understand where they're coming from, because I've done this, where I'm like, I got that. Oh, yep, I probably have that. And the hard part is when you start to dig, you're digging in the wrong direction with knowledge, but not with facts and not with results. So with Tourette's, there is no blood test that can be done. Anxiety and depression, there's no blood test that can be done to show that you have those things. But there might be something causing the stress and the anxiety and the depression, that it can come in a result of maybe your blood sugar is too low. Maybe you don't have specific supplements that you need, or vitamins and minerals, or maybe your hormones are off, or maybe just whatever, something is going on internally. And then there's times where you do all of these tests and everything comes back normal, and you're still like, well, I have all these symptoms. And that is dangerous, because that could be a mental health issue. And it also could just be that you're overthinking and overstressing it, that your body is feeling that stress, and that the body is reacting to how you're sleeping or how you're eating, and we're conflating it with an illness. So it is very tricky. Our minds are very tricky, that we have to be very careful not to overdiagnose or underdiagnose our symptoms. And we do want to work with a doctor, but we want to be very careful with the doctors that we're working with. So let me explain that. When we're working with a doctor who's just prescribing all of the stuff that we're asking for and not running tests, there is a problem, because they're just giving us the medication that we need and not actually running tests to make sure, first off, that we actually need that medication. And secondly, that the medication we're using isn't damaging more of our body. So when we are looking at this issue of misdiagnosing, it actually shows, if you look it up, you can Google this, but look it up to see what the statistics are of misdiagnosing in the US. In the US alone, we have 12 million people being misdiagnosed in a year. Now, Let's Get Checked actually did a survey, and they said 40% of Americans misdiagnose themselves online. And 74% said that stressed them out. Like, looking at these symptoms and diagnosing themselves actually stressed them out more. And then 65% of these people that took the survey said that they Googled their diagnoses by their symptoms. So these numbers are really high, because it's so easy just to Google it. And before TikTok even existed, for like the last I remember since Google came out, is people would literally go to their doctor and say, I Googled this, or I watched this TV show and they said XYZ was the symptoms. I have those symptoms. I have that diagnosis. I need you to give me this medication or I'm going to die. And I think the reason that it's so high is, in numbers of why people are misdiagnosing themselves and being misdiagnosed, is that we often come in to the doctors with the sole purpose of getting a medication versus the sole purpose of being patient through the process. Now, I'm going to tell you right now, getting a diagnosis takes time. It takes so long. And it is honestly easier just to be like, I have a migraine, give me strong medications because I'm tired of having the migraines. But we have to be patient to say, okay, yes, there's this pill that we're going to take for a small period of time while we look at figuring out what is causing the migraines. Now, the migraines could be something serious, but it also could be as less severe as you needing to get a chiropractic adjustment because maybe a muscle or something's out of alignment and it's causing strain on the back of your neck, which is causing strain on the muscle, which is causing your migraines. Stress also causes migraines. So if you're like, well, can't get rid of stress, I'm like, no, but you can reduce it. And you can eat healthy so that your body's getting what you need. And sometimes migraines are genetic and it's based off of a lack of something in your body. So when we are doing what we're doing, we want to find two things. We want to find a doctor who's not just going to give us medication and that is going to run tests. But we also want to go in with an understanding of what is our health? What is our health actually at? Are we eating a ton of crap all the time and expecting our bodies to be okay? We have to put healthy stuff in our bodies because it gets our bodies the energy that it needs. It gets the nutrients that it needs, and it just helps our body. So when we are looking at this, I want you to understand that oftentimes we're only seeing our primary caregiver, our primary care doctor, and they are not specialized in a bunch of these different areas, which is why they have to refer you out. But we get so upset over the process that we're like, well, we don't want to see another doctor. We just want the medication. It worked for my friend over here. Like, why can't I get that medication? And there are certain medications that our body cannot tolerate, and dosages come into a huge factor into all of this. So if I were to take an 800 milligram ibuprofen, that might help me, but for my husband who is taller, he has a different body build, he is going to have to either have more or a stronger medication. But both of us are at a danger if we're self-medicating, we're at a danger of overtaking a medication and becoming addicted to it. So I want you to hear me out. There are some horrible doctors out there, but there are a lot of good doctors out there too. You have to find them. You have to find someone to advocate for you, but you do not want to find a doctor who is just going to push medication at you and walk you out the door. So I wanted to say that first. Now, because it is so dangerous to self-diagnose, you either overtreat yourself or undertreat yourself with the medications that you need. Now, I think there's a lot to the situation. And if you're overdiagnosing yourself, you're actually putting yourself on a wrong treatment plan. If you are underdiagnosing yourself, you're doing the same thing. You're not getting the right treatment for your body. Now, again, I go back to ibuprofen, because if you take ibuprofen at a high dosage and you take it consistently, and it's like you're every single day taking it, or you're taking it several times a week and you're overdoing it, you actually run the risk of compromising your immune system, and you run the risk of internally hurting your internal organs. So when we're doing this, we need to make sure we're on the right milligram, and a doctor should be able to help us with that. And when they say don't take more than 2 a day, they mean don't take more than 2 a day. So one of the things that I think about is that when we're overdiagnosing or underdiagnosing and we're self-medicating ourselves, we're actually putting our body more at risk. And sometimes what tends to happen is as we take a certain medication, we have to go get a second medication to help us with the symptoms from the first one. And that can get really dangerous, because then you're just throwing a bunch of junk into your body and you're expecting your body to work, and your body starts shutting down. Now, there is a show that is called Gypsy on Hulu. This is my plug. If you haven't seen it, I want you to watch that. It is a hard show to watch because it does talk about the pharmaceutical company and how it was pushing drugs out to different patients, and they were just pushing drugs out to sell drugs. They were not pushing a drug out that actually helped people. They were all about the profit for themselves. Now, what they were doing was they were telling doctors that it was safe to move someone from a lower dosage to a higher dosage to help alleviate their pain. They would also say the phrase, 1% or less gets addicted to this drug. You can't get addicted to it. Now, the downside is that in this show, they started to show the effects of addiction. And so if you have watched someone have an addiction, I totally get not wanting to watch this, but like I really do encourage you to watch it because it's very eye-opening of how when we push just a medication versus actually trying to relieve the underlying issue, we could do a lot of damage to our body. We can get addicted to drugs and things like that. So when they started to show the patients that, they got to the highest milligram possible, the patient would start not really by themselves, but like with direction we'll take a little bit more. And so patients were in a lot of pain. It was not just like a headache pain. It was like full body pain, and they were injuries. So they started to take, instead of the recommended dose, they started taking more after getting their milligrams increased. So they upped their dose, and then they started upping how many pills they were taking in a day. And they were going around and trying to get relief for a period of time, and they were succeeding when they did this, but then it would wear off and their body got used to the dosage amount. And so they would go to a higher pain pill, or they would resort to using drugs. So when you use these medications, it's only supposed to be a period of time, but these patients started to get addicted to it long term. And then they started seeking hard drugs. And so there's this danger when we self-medicate and self-diagnose, is that we might be taking the wrong medication that does more damage on our body than good. Yes, drugs can lead to overdosing and dying. Within the United States, according to the National Survey on Drug Use and Health, 19.7 million people in the US, 19.7 million from the ages of 12 years old and older have battled a substance use in 2017. This is 2017 numbers. They also stated that 8.5 million people of the adults, 8.5 million adults suffered both from a mental health disorder and a substance use disorder or abuse. So you have all of these people who have an underlying issue of some sort of mental health, and they're using just different pills or drugs or medications to self-medicate and self-soothe. Their body gets addicted, so then they go to something else. You're treating the symptom, not the actual underlying issue. And so you have this difficult decision to make. It leads to self-diagnosis. It leads to self-medicating, and it becomes a reliance on this drug or medication to continue living. Now, there's some times where that's needed, like anxiety medication or depression, or if you have diabetes, there's medications that are needed for you to be on lifelong. But you need to be running in tests with your doctor and making sure it's the right medication and the right dosages, and making sure that medication isn't damaging more of your organs than it would without. But when we're taking a hard pill, like a painkiller, at some point your body is just going to be like, this isn't enough, this isn't taking the edge off, and I need something stronger. So for me, it's very interesting to kind of look at the statistics and look at the numbers and not address the underlying thing. There are so many people with a mental health disorder or disability or issue going on that's not being looked at and fixed. It's just, here's a medication, go take this. And sometimes that's self-medicating, and sometimes that's what we're getting medicated, prescribed by our doctor. So we got to be really careful with that. Now, here's the problem, is that sometimes it moves away from us self-diagnosing ourselves to starting to self-diagnose other people. So we start to look at our kids or family members or friends and be like, you must have this. And you have no reasonable reason to think of this, but you start to think like, oh, you have this disease or this illness or this disorder because I know the symptoms. And then you start to tell that person these things. And then again, self-medication happens for those individuals. Now, there's a danger of this too. And one of those dangers can be Menchensen syndrome by Proxy and Menchensen syndrome. Now, Menchensen syndrome is when a person believes that they have an illness and they start to pretend they have an illness. Menchensen syndrome by Proxy means when a caregiver makes up or even causes an illness for someone that they're taking care of. One famous story that I know of is Gypsy Rose Blanchard. So her mom, this story is wild, by the way. Her mom had been lying about Gypsy's syndromes, illnesses since she was born. Originally, she first started saying that Gypsy was not sleeping. She had sleep apnea as a baby. And by 8 years old, her mother had said that she had leukemia, muscle dystrophy, and was bound to a wheelchair and needed a feeding tube. So here's where it gets crazy. She would tell people that her daughter had seizures, asthma, hearing, and vision impairments, and she would give her daughter medications based off of this. She even got to the point of being able to successfully put her daughter through surgeries and procedures on her eye, removing her salivary glands, and then like other surgeries, putting a feeding tube in, all of these things. Eventually, Gypsy's teeth started to rot, and she had to get those pulled out. So this is the kicker, though. Her mom had made her entire family, the dad of Gypsy, believe that she was sick. And people were like praising her and helping her financially and doing all of these things to try to make sure that, Gypsy was taken care of and her mom could take care of Gypsy. Gypsy did not need a wheelchair. She could walk. She did not have cancer, and she actually did not need a feeding tube. She was completely healthy, but her mom had a mental health issue, and they believe that her mental health issue drove her to wanting to be a caregiver, and so she created this opportunity to make her daughter sick by giving her all these medications and then telling her, you need to not tell anybody. Like, you let mom do the talking is what happened. Now, you might be asking yourself, like, how did a doctor allow this to happen? Like, how did doctors do this without running their own tests? So there's a couple things that actually happened. So her mom actually first told Gypsy, like, you're not allowed to say anything. You can't say anything. I will do all the talking. She gave false information and files to the doctors, and then would move Gypsy away from family or away from places when people started asking too many questions. So she isolated her and then would move her away and be like, oh, I need to go get the best doctors and stuff like that, and then move her away. So then her mom started using Hurricane Katrina as an issue and said that all of the doctor files were wiped. So there was no way to get it because they had lost it in this hurricane. Now, she also lied about Gypsy's age to keep her in, like, to get medical waivers to handle all her health and not let Gypsy speak to the doctors. So there was actually no medical evidence that proved that Gypsy had any of these things, but it was falsified information. So this is the hard part is that it's not funny. I don't know why I'm laughing. I think it's just so overwhelming that I'm like, oh my gosh, like, this is a real story. But Gypsy started to want her own lifestyle, and she was 19 years old, and she was being, like, her mom was saying, like, she's not 19, she's younger than that. And when you're getting from a young age, when you do a lot of medications, you do a lot of these treatments that are unnecessary, your growth is stunted. And so she looked a lot younger than what she was. Even though she was 19, she did look like a little girl. And so, there's pictures you can find of her. So eventually Gypsy wanted to have her own lifestyle, and she finally started, like, getting onto this dating app and met this guy and told this guy, like, this is actually what's going on. This is how I'm being treated. Oh my goodness. Like, whatever. And that man came over and ended up killing her mom. So Gypsy and the man both went to jail, and you might be like, yeah, she should have, and like, blah, blah, blah. But like, she shouldn't have killed her mother. And you're right. She shouldn't have killed her mom. But when you are isolated that way, you're being medically abused, emotionally abused, and physically restrained, you will do something crazy. And that is such a hard thing to like imagine why a parent would be okay with their daughter being treated the way that they were. And you think about like, well, where was her dad? Her dad was lied to as well, and then wouldn't see Gypsy for a long time again because the mom would move them so that way she could get the best medical care, or they needed to get closer to this doctor or that doctor, or like, we're just moving over here, and you just have this, you have a lot of questions, I think, with a situation like this. But it happens a lot. And the only reason we know this story is because it made the news, because her mom was killed and she was put in jail. And I think, to me, it's such a danger that when we're not getting that underlying issue taken care of, we either can get addicted to medications, we can get addicted to the attention of what we get when someone's like, oh my gosh, you have this illness, I'm so sorry. We could lie about the illness. Mental health issues happen, and then we can push that onto our children. And in these cases, like, we miss the mark as someone maybe being in this person's life. We miss the cues of something's not right. When someone says, I have all these diagnoses, we tend to now look at that person and be like, you're lying. But there are a lot of people out there that have a lot of diagnoses, and it's true. But because of a case like this where someone faked it, now we look at everyone with, oh, you're a liar. And that's not the case. No one has to prove their illnesses to you. But if you are someone who is lying about your disorders and illnesses, don't just stop lying. That's not cool. But there's just a lot to this. When we're diagnosing ourselves and self-diagnosing, we're actually stressing our mind out on what is really happening to us. And we could make our symptoms a lot worse. And when we start to self-medicate, we make our symptoms a lot worse. And we hurt our body more. And the reason I bring up Gypsy's story is because her teeth started to rot. And that, they believe, was because of the medications that she was on. And so, when they started running tests on her, they actually were able to get some tests and stuff that showed that she didn't have leukemia, that she never had anything wrong with her, that her body was very healthy. They were actually very surprised that the medication she was being given didn't damage her more. But now, there's more mental issues being added to this situation. And so we want to be careful, because when those kind of things happen, we need to be alert to be able to help. So, the issue with self-diagnosing is that, again, it leads to overdiagnosing and underdiagnosing, and then it leads to self-medication, and that could lead to addictions, and that could lead to someone completely just being like, I like attention when I'm sick, so they lie about being sick, or they put it on someone else, and they're like, well, this person's sick, feel sorry for me, and it's a huge, huge mess. And so we want to be careful, because we want to make sure that we're getting multiple doctor visits, and we're going to go back and get just tests done and get a second and third opinion to really make sure what we have is there, so we can get the right treatment plan. Now, I know fear drives a lot of things. I know people who have done tests to see what genetically happens in their, what they might be prone to with illnesses and disorders and diseases. And then they have done their own treatment plans to prevent that thing from happening, because they're like, I'm so afraid of getting cancer that I would rather get a hysterectomy, or I would rather get this taken off of me or this taken out of me, so that way I don't get this, because this blood test said that I could, that I was prone to it. And I understand that. But what we have to stop doing is allowing fear to make our decisions for us, because that fear can actually lead to more issues down the line. And nothing Nothing is worse than going down this self-diagnosed plan with this self-treated medication than waking up one day and being like, I could have prevented this by doing the correct steps and being patient. I could have eaten healthier. I could have worked out and walked. I could have taken the right medications. I could have prevented myself from taking those medications. And it all led down to this route. So I just want to encourage you to stop self-medicating. Stop self-diagnosing, because that does stress you out more. If you are concerned, go get the tests that you need to get. Talk to someone in the field. Find someone that you do trust. Don't just find the yes doctor, and don't find the doctor who's just not going to do your tests for you. Find someone who's in the middle, who can be like, okay, we've run these tests. Yes, this is confirmed. No, this is not. Let's try this. But also, again, really look at how you're eating and moving your body. Because again, it's interesting that a lot of this comes down to like underlying issues. Some symptoms, it's underlying stress, underlying anxiety and depression. And if you get those under control, your symptoms go away. So this one was a little bit longer than normal, but I just feel like this is really important to talk about. So thank you for listening, first off. But next week, we're going to be joining in on a conversation, and it's going to be called It's This or It's That. It can't be both. We're going to be talking about some heavy topics that when people are saying, you can't stand in the middle, you have to either stand on this side or on this side. And if you don't choose a side, it's this or that. And I want to talk through what that looks like in different circumstances. So I am really excited to jump into that conversation with you, and I hope to see you next week. You have a wonderful day. Bye, you guys.